In this video, we are going to provide you the information about the currently available COVID-19 vaccines. All the information that we are about to present to you here come directly from CDC. This video is being made on March 20, 2021. As you can see from the top to the bottom of the poster, the questions that we are going to answer include: how do the vaccines work? What are the currently available COVID-19 vaccines in the United States? Who can get vaccinated? What is the current vaccine plan in Connecticut? And what are some possible vaccine side effects? Lastly, we are going to talk about the immunization timeline of the vaccines.
There are 3 currently available COVID-19 vaccines that are approved on the market. These vaccines cannot be compared head-to-head to each other. However, studies have been done to assess the efficacy of the vaccines. The Pfizer-BioNTech vaccine is approved for individuals who are 16 years or older, and it is comprised of 2 doses that are 21 days apart. It is studied to be 95% effective. The Pfizer-BioNTech vaccine is approved for individuals who are 16 years or older, and it is comprised of 2 doses, 21 days apart. It is studied to be 95% effective. The Moderna vaccine is approved for individuals who are 18 years and older. It is comprised of 2 doses, 28 days apart, and it is studied to be 94.1% effective. The Johnson & Johnson vaccine is approved for 18 years and older with just 1 dose, and it is studied to be 74% effective. Although the Johnson & Johnson vaccine trial showed a lower efficacy rate in preventing moderate to severe cases of COVID, it was very successful in stopping serious illness and 100% effective in preventing hospitalizations or death. All 3 vaccines provide nearly complete protection from developing severe infection, hospitalizations, and death from COVID-19. How do the different COVID vaccines work? There are differences between the Pfizer, Moderna, and the Johnson & Johnson vaccines and how the mechanism of action works in the body. For the Pfizer-BioNTech and Moderna vaccines, these are mRNA vaccines. Thus, the vaccine contains the genetic material that codes for the SARS-CoV-2 spike protein. In comparison to the Johnson & Johnson vaccine, which is produced by Janssen Pharmaceuticals, which is an adenovirus vaccine. This uses a common cold virus that is inactivated and thus cannot grow, which contains the DNA code required to make the SARS-CoV-2 spike protein. In conjunction, all 3 of these vaccines work similarly to each other once they are injected into the deltoid muscle. The vaccine enters the muscle cells, which produces the spike protein. Beware, this vaccine does not alter a cell's DNA. Once the spike protein is made in our cells, our immune system recognizes that the spike protein is foreign to the body, which thus produces antibodies and activates T cells. Once the body has antibodies developed, and if you are exposed to the COVID-19 virus, the antibodies and T cells are then activated to fight the infection.
Who can get vaccinated and who should not get vaccinated? So anyone who is 16 years old or older can receive the vaccines. Also, those who are immunosuppressed or pregnant may check with their healthcare provider before receiving the vaccines. And for those who have a history of a serious allergic reaction to any ingredient of the vaccine should not get vaccinated before checking with their healthcare provider. In the state of Connecticut, there's a rollout plan for the vaccine. Currently being scheduled is healthcare personnel, medical first responders, long-term care facility residents and staff, along with the residents and staff of congregate settings, and educators and child care providers. Those who are 45 or older are also currently eligible for the vaccine. Starting from April 5th, anyone who is 16 years old or older is eligible for the vaccine. You can also check out the website of Connecticut COVID-19 vaccine for more information about vaccine scheduling.
One may receive side effects from the vaccine, which includes arm pain, swelling, and redness. Other effects may include tiredness, fatigue, fevers, and the chills. These effects are normal signs of the vaccine, which means that your body is building protection from the virus. The side effects usually go away in a few days. Some people may have no side effects at all. If you do experience some side effects, you can apply a cool, wet washcloth on the arm. Also, please drink plenty of water and exercise and stretch your arm. You can also take over-the-counter pain or fever relief, such as ibuprofen, acetaminophen, or aspirin, for any pain and discomfort you may experience after getting vaccinated. It is not recommended to take pain or fever relief medications before receiving the vaccine. What are some common questions about the vaccines? Can I still spread COVID-19 after receiving the vaccine? It appears so far that the vaccines may be able to prevent or at least reduce your risks of spreading the virus to others, even if you do not get sick yourself. How long does protection from the vaccines last? So far, at least 3 to 4 months. We will learn more about the duration of protection and whether we may need booster doses in the future as it is studied more. We also have presented to you a visual representation of the immunization timeline for the vaccines. For the Pfizer, BioNTech, and Moderna vaccines, there are 2 doses, either 21 or 28 days apart. After receiving both doses, your body will be protected from COVID-19 approximately 1 to 2 weeks after receiving the full sequence of the shot. For the Johnson & Johnson vaccine, there is only 1 dose, and it has been studied to see that your body is protected from COVID-19 approximately 2 weeks after receiving the dose. When you combine the vaccine with social distancing precautions, then our community will be able to reach the herd immunity threshold, which means vaccinating an estimated 70% of the population, according to some health experts.